us a little bit about Diastat or Medazelam, the emergency medication. Which patients for whom seizures are diagnosed do you prescribe them for?
Diastat and Medazelam are benzodiazepines, and they're used as emergency rescue medications to stop a seizure before it goes on too long. Generally, given the new definition of status epilepticus, which means an enduring seizure state, we ask parents to be prepared to administer, or caretakers to be prepared to administer the medication at 5 minutes. Diastat was sort of the original one product that was on the market and came out. It's rectal, it's preloaded and pre-dosed with really easy administration. It's portable, it comes in a kit of 2 and can go with the child, and one can be at school, one can be at home. We generally prescribe an emergency rescue medicine to pretty much everyone, because if you have a diagnosis of epilepsy, particularly in the beginning, when you first start medication, you don't know whether it's going to completely control it or not, and you don't know how much the dose is going to need to be to control it. And there's always the risk in anyone who has epilepsy throughout their lifetime of status epilepticus occurring, be it triggered by getting ill, run down, or some other factor, or just spontaneous. So because that risk is there, we pretty much always think about what if an emergency happened and make sure that there's some plan to address it. Practically speaking, the people we don't prescribe it in are really ones who we think the risk is pretty low and the medicine is really expensive. So if we don't think you're really ever going to need it, then it becomes we weigh it, especially if the parents are close to help. In terms of Medazelam, that's a nasally administered medication, and obviously for the teenagers particularly, it appeals big time over Diastat, as they imagine themselves having a seizure in the cafeteria and having to go through the humiliating experience of having their pants pulled down. And I think that's very understandable. Usually by the time you're getting Diastat, you really don't know where you are or what's going on. But it's hard to convince someone of that. And Medazelam is very easily administered. It's a liquid, it's sprayed up the nose through an atomizer device, and it works as well, clearly, as Diastat. The problems with it really are only that someone has to draw up the dose at the time with a non-shaky hand, transfer a needle to from the syringe, take it off, put the atomizer on, make sure it's secure enough that it's not going to pop off when you put the little pressure on the barrel of the syringe. And other than that, it's easy, it's portable, and I think is gaining more widespread application and usage. It's not yet approved for that purpose and hasn't been studied as extensively as Diastat. So there's a certain body of evidence that doesn't support it as much as Diastat. But I think that's just a matter of doing a study or two, because it's clearly as effective.